Ever wondered what those strange sensations you occasionally experience might be signaling? Those peculiar feelings that sporadically occur might be your body trying to communicate with you. Yes, your body does have its own unique dialect, a language that is often overlooked. It's a complex system of signals and responses, physiological reactions that are often misunderstood or ignored. Every sensation, every twinge, every subtle change could potentially be your body communicating essential information. It might be an alert or a call for you to take some necessary action for your overall health. It's high time we learn how to understand it. Number 1, persistent headaches. These throbbing inconveniences are part and parcel of everyday life. However, what may seem ordinary could be an indication of something far more serious. Sure, headaches can result from various factors. Stress is a common culprit, often triggered by personal or professional pressures. Lack of sleep, too, can bring about headaches, as inadequate rest disrupts the body's internal clock, causing discomfort. Another trigger for persistent headaches can be dehydration, where your body is crying out for water. Even a poor diet can make you prone to headaches. When your body is not receiving the necessary nutrients, it can react with a pounding headache. But sometimes, these headaches persist, refusing to leave your side. This persistence can be a red flag, a warning sign of more serious health conditions. These could range from chronic issues like migraines, where the pulsating headache is often accompanied by nausea and sensitivity to light and sound, to high blood pressure, where the increased force of blood against your artery walls can lead to a throbbing headache. More alarmingly, your persistent headache could even be a potential sign of a brain tumor. This is a severe condition where abnormal cells form within the brain, causing pressure that manifests as persistent headaches. So it's extremely important to not underestimate or brush off persistent headaches. Instead, pay heed to this distress signal your body is sending and seek medical advice. Your persistent headache isn't just a minor inconvenience. It could be a messenger, warning you about underlying health conditions that need your immediate attention. Number 2, chronic fatigue. If you're perpetually exhausted even after getting a good night's sleep, your body could sending you a distress signal. Chronic fatigue is more than just constant tiredness. It can be a symptom of more serious health problems. This could indicate conditions like anemia, a condition where your body lacks enough healthy red blood cells to carry adequate oxygen to your tissues, or diabetes, a serious illness that affects how your body uses blood sugar. Chronic fatigue can also be a sign of heart disease, where your heart's blood vessels are blocked or narrowed, preventing your heart, brain, and other parts of your body from receiving enough blood. Additionally, it could signal thyroid issues. These regulate your body's metabolism and energy production, and when out of balance, can cause persistent tiredness. Other possible causes can include mental health issues, sleep disorders, or even chronic pain conditions. Chronic fatigue can have a profound impact on your daily life, diminishing your energy, mood, and concentration. It's imperative to listen to your body's signals and consult a medical professional if you're always feeling drained. Number 3, unexplained weight loss. Losing weight without trying might seem like a dream come true for most, and in a world where weight loss is often equated with health, this unanticipated shedding of pounds might initially seem harmless or even beneficial. However, it could be a stark warning sign of a plethora of serious health issues. Among these are chronic conditions like diabetes, where high blood sugar levels can cause frequent urination and therefore lead to loss of calories. Another possible cause is thyroid disorders, in which an overactive thyroid can accelerate your body's metabolism, causing unexplained weight loss. Certain types of cancer could also be culprits, as cancer cells often use up more of the body's energy, leading to this symptom. But the list doesn't stop there. Other potential causes could be gastrointestinal diseases, such as Crohn's disease or peptic ulcers, which can affect your body's ability to absorb nutrients, leading to weight loss. Mental health conditions like depression and anxiety can also result in reduced appetite and weight loss. Additionally, serious infections or parasites might cause weight loss as your body works overtime to fight them off. The effects of such unexplained weight loss range from physical to psychological. Physically, it might leave you feeling tired and weak, slow your healing process, and lower your immunity. Psychologically, it can lead to stress and anxiety, especially if the cause remains unknown. So if you're noticing those pounds are shedding without any significant changes in your diet or exercise regime, it's not just time for a checkup, it's time to ring the alarm bells. Your health is paramount, and unexplained weight loss could be your body signaling that something off balance needs immediate attention. Number 4, shortness of breath. You've likely encountered the sensation of gasping for air after climbing a flight of stairs. But if this is a frequent occurrence, it might not just a sign of being out of shape. Shortness of breath, or dyspnea, isn't always due to a lack of fitness. In fact, it could be an alarm bell for more severe health conditions. These might include heart diseases like coronary artery disease, heart failure, or arrhythmias. It could also be a sign of lung diseases such as chronic obstructive pulmonary disease, COPD, pneumonia, pulmonary embolism, or asthma. Shortness of breath could also be indicating other conditions like anemia, obesity, deconditioning, or even anxiety disorders. Regardless of whether it's mild or intense, if you're regularly experiencing shortness of breath, it's important that you seek medical attention. It's not a symptom to dismiss lightly, as it could potentially be a sign of a life-threatening disease. In addition to the physical discomfort and potential health risks, shortness of breath can also impact your quality of life. Activities once carried out with ease, like walking, exercising, or even simple household chores, can become challenging. So don't just write it off as a lack of fitness or aging. Get it checked out. It's far better to be safe than sorry when it comes to your health. Number 5, persistent digestive issues. It's not unusual to experience infrequent stomach upsets as part of our daily lives. However, if these digestive problems persist, it's a signal that something's not right within your body. A lengthy list of conditions can be tied to such persistent symptoms. These range from celiac disease, a chronic autoimmune disorder where ingestion of gluten leads to damage in the small intestine, to irritable bowel syndrome, which can cause abdominal pain, bloating, diarrhea, and constipation. Gastric cancer is another potential cause, a type of cancer that begins in the stomach and can lead to more serious health issues. Other potential causes can include inflammatory bowel disease, gallstones, or pancreatitis. The effects of these persistent digestive issues can infringe on your daily life, causing discomfort, pain, and even lead to more serious health complications. Therefore, it's essential to not ignore these persistent symptoms and consult with a healthcare professional for diagnosis and treatment. Number 6 on our list is frequent urination. An often overlooked but important health indicator is the number of trips you make to the washroom. If you find yourself constantly dashing to the toilet, it's not always a matter of a small bladder. This frequent urge could indicate a variety of underlying health issues. It might be a sign of diabetes, a disease in which your body either doesn't produce enough insulin or can't effectively use the insulin it does produce. Urinary tract infections, or UTIs, can also cause frequent urination. These are infections in any part of your urinary system, namely your kidneys, bladder, ureters, or urethra. For men, frequent urination may be a symptom of prostate problems. The prostate is a small gland in men that produces the seminal fluid that nourishes and transports sperm. Problems with the prostate can lead to frequent urination. Additionally, frequent urination can be a sign of overactive bladder syndrome, kidney disease, interstitial cystitis, also known as painful bladder syndrome, or even a side effect of certain medications. It can also be a symptom of pregnancy in women. The effects of frequent urination can be bothersome and can impact your daily activities. It can disrupt your sleep, leading to fatigue, and it can also cause embarrassment and anxiety. In extreme cases, it can lead to dehydration. Therefore, it's vital not to ignore this symptom and seek immediate medical attention if you notice a consistent pattern. Moving on to number 7, the changes in your skin. Our skin is like a mirror, often reflecting our overall health. If you notice unexplained rashes, persistent acne, or sudden changes in your moles, it might be more than just a skin-deep problem. Unexplained rashes could be your body's response to an allergen or a symptom of an autoimmune disease like lupus or psoriasis. Persistent acne isn't just a teenage issue. It could be a sign of hormonal imbalances or even polycystic ovary syndrome in women. Sudden changes in your moles, such as changes in size, shape, color, or if they start to itch or bleed, are a cause for concern as they can be an early sign of skin cancer. Apart from these, skin dryness could indicate dehydration or thyroid conditions. Yellowing of the skin could suggest liver disease, while a bluish tint could signal heart or lung diseases. It's noteworthy to mention that our skin can also act as a shield, protecting us from harmful pathogens and excessive water loss. So, pay close attention to the signals your skin is sending you. They could be indicative of underlying health concerns. Number 8. Memory problems. People often dismiss occasional forgetfulness as a normal part of life. However, persistent memory issues could indicate more severe underlying problems. Frequent forgetfulness might be a symptom of brain-related conditions such as Alzheimer's disease or other forms of dementia. It's also worth noting that memory problems aren't exclusive to these diseases. They can be a result of stress, depression, sleep deprivation, and even nutritional deficiencies. Certain medications can also have side effects that affect memory. Chronic memory problems can lead to difficulties in daily life, causing trouble with work, social interactions, and overall quality of life. It's essential to track these symptoms and seek professional help if memory problems persist. Finally, we arrive at symptom number 9, constant thirst. If you find yourself perpetually parched, a thirst that refuses to be quenched despite a consistent intake of fluids, this could be an alarming signal of diabetes. Chronic thirst is a textbook symptom of elevated blood glucose levels, and in the medical world, it's known as polydipsia. But what differentiates this relentless thirst from normal thirst is a crucial question to ponder upon. The distinction lies in the accompanying symptoms that are crucial to be observant of. You might experience a nagging dryness in your mouth, a medical condition referred to as xerostomia. This doesn't just leave your mouth feeling arid, but can also spawn further complications such as difficulty in swallowing, mouth ulcers, and even a marked alteration in your taste perception. Another accompanying symptom that could sound alarm bells is frequent urination, scientifically termed as polyuria. This isn't just about a few extra bathroom breaks. You might find yourself roused from sleep multiple times in the night to urinate, despite not having consumed significant amounts of liquids before bedtime. Moreover, you may also notice unexplained weight loss accompanying this unending thirst. This isn't the type of weight loss that happens due to a well-regulated diet or physical exercise. If you notice your weight plummeting without any discernible reason, it's crucial to seek medical attention. It is worth mentioning that constant thirst can be indicative of other conditions such as dehydration, side effects of certain medications, or even psychological conditions like psychogenic polydipsia. Therefore, it is necessary to get a complete health checkup. To conclude, if you're incessantly thirsty and are also experiencing symptoms like a dry mouth, frequent urination, and unexplained weight loss, it's possible that you might be suffering from diabetes. Recollect, early detection is the key to managing this condition effectively. In summary, your body communicates through signals: persistent headaches, chronic fatigue, unexplained weight loss, shortness of breath, persistent digestive issues, frequent urination, skin changes, memory problems, and constant thirst. These are all signs that shouldn't be ignored. They might be your body's way of telling you that something's not right. Paying attention to these signs and seeking medical advice can help detect potential health issues early, increasing the chances of successful treatment. Remember, your body is your best health advisor. It's time we start listening to it.